Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanotoo on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.
Hello, ladies and gentlemen. Once again, you are most welcome to the online pregnancy school. My name is Dr. Linda Vanotoo, and it is always a pleasure coming your way with the online pregnancy school. We have had a lot of sessions where we have spoken about pregnancy, infertility, how the baby grows, and a whole lot of other things that will help us to make pregnancy a good experience, so that pregnancy does not become a time of anxiety and fear, but you will know more about it and take action when you see that something is going wrong. And one of the reasons why we are doing this is we want people to join so that we can reduce the preventable maternal and newborn deaths. I hope you'll be part of this. And if you are going to be part, then I invite you to go ahead and hit that subscribe button. Also turn on the notification bell so that anytime we are coming up with another video, you will be informed and you will join us. And please share with friends, share with family. Do share so that people would also learn and know what to do when they find that there's something going wrong. Take quick action. Go to the hospital. For those who have been joining us, we say a very big thank you. Continue joining us and continue sharing. And for those who have sent us comments, we are very grateful for all the comments you have sent, even encouraging us to continue. It means that you are benefiting, and that is what we want to see and hear. So continue sending the messages and we'll be happy to answer the questions for you. And ladies and gentlemen, I want to just let you know that some people are also benefiting, because we have had questions, we have had people reaching out to us asking what they should do about particular issues. And by God's grace, we have been able to answer those questions and the outcomes have been good. So please go ahead and hit that subscribe button and also share with others. In the last 2 sessions, we spoke about the child. We looked at some of the causes of child illness and deaths. And then we also spoke about some of the interventions that are available. If you are in Ghana, you realize that there are so many interventions that are available for you. And one of the things that came up is that if you have health insurance, then when you go to the hospital, a lot of these are free. In fact, somebody sent a question that, what about the laboratories that sometimes you have to pay for? Some of the things that are requested for, they are for your own benefit. So if it is found that it is not on the insurance, which may be very minimal, then please just try and also do that. So I would suggest that once you find that you are pregnant, start saving some money so that whatever is not covered that you still need and which is requested for you, you can go ahead and use some of that money to do that, including some lab tests. I don't know, but if truly that is the case, that you need to do something which is not covered by the insurance, don't let that be a hindrance for you not to benefit from the services of the health sector. So please do that. Ladies and gentlemen, today I am going to talk about a topic that has not received so much attention. And it is rarely talked about, although it causes a lot of pain to women and families. It can leave women devastated for many years. I met a lady who for 30 good years after that happened, she was still trying to understand what happened. Why did this happen to me? And this is a topic that, when it happens, sometimes brings friction into the family, especially if it happens more than once. Then it becomes a challenge the woman would receive a lot of stigma. And in fact, she would not be happy in the presence of other people. It can even lead to divorce because of the pain that the mother goes through, especially if it happens more than once, and also the fact that it is not really spoken about and it is not properly understood. And then in some instances, there are some beliefs and practices surrounding this particular occurrence. And therefore, when it happens to a family, they have either they take it that, well, it is good that it happened, or they take it that this is a bad omen, especially for the woman who unfortunately experiences this more than once. It is quite common. It happens in both the so-called high-income countries and the low and middle-income countries. What is this topic that we are going to look at today? It is about stillbirth. It is about stillbirth. And we will be having more than one session on this. But for today, I'm going to take you through the definition, the types that we have. We'll look at the statistics and then the causes. So today we are talking about stillbirth. Join me. And if you have not yet subscribed, please go ahead, hit that subscribe button, and let us together work at reducing preventable maternal and newborn deaths. So, what is stillbirth? You know, stillbirth, as we know it, is a baby who is born dead. Unfortunately, at the time of birth, this baby does not show any sign of life. And that means that there are issues that occurred when this baby was in the mother's womb. And unfortunately, again, even though it is a common occurrence in both the low income and the high income countries, it has not received so much attention as other conditions have received. And here I don't want to mention any condition because every life is important. So if attention is being given to a particular disease or a particular condition, it is important because it's also affecting a human being. But this particular condition, the stillbirth, has not received so much attention, although it causes a lot of tragedy and a lot of pain to families. There are psychosocial, psychological, and a whole lot of other effects that take place in the woman who delivers a baby that is not alive. Can you imagine? Can you imagine yourself carrying this baby and just hoping that this baby will come out alive? Because sometimes you feel the baby moving, you crave for certain things, and finally, when the baby comes, this baby is not alive. There are also some taboos and misconceptions and beliefs around stillbirth. And let me share just one or two with you. For example, if a woman delivers a baby that is not alive, then this woman is told not to cry or grieve for more than 2 weeks. And the reason is that if you cry for more than 2 weeks, then this baby will come back and leave you again. So your crying for more than 2 weeks will lead you to either not having another pregnancy, or when you become pregnant, you will lose that child again. So you can grieve, but it should not be for more than 2 weeks. Another thing is that some of them don't even allow the mothers to see these babies because they don't know what will happen to the mother. Maybe she cannot stand the sight of her dead baby, so she is not allowed to see this baby. In other instances, it is the person who delivers this mother that buries the child, so she doesn't even know where the baby was buried. So you can imagine that she may not see the child, and she would also not know what they did to this baby and how the baby was even buried. Now, in some other instances, it is seen as a bad omen for a woman to deliver a stillbirth. So when that happens, then this woman unfortunately becomes stigmatized from the family and from the people in the community. So you can imagine that somebody who has lost her baby now has to go through some of these effects of having a stillborn, and that causes a lot of psychological trauma to these mothers and sometimes even to the fathers. So you find that it is a topic that really needs to be discussed, and that's why today I am talking about stillbirth. And even though when you look at the past 20 years, the numbers have reduced, they have not reduced as much as we have reductions in maternal death and under 5 childhood deaths. So if you take mothers who are pregnant or who have delivered, some of them die, unfortunately, but the reduction in the numbers that die are higher than the stillbirth. And if you take children under 5, you find that those that die, the numbers have also reduced compared to the stillbirth. So there is some improvement in maternal mortality reduction as well as childhood death reduction, but it is not the same for stillbirth. And even though that is the situation, as I said earlier, stillbirth has not received that kind of attention internationally, globally, locally, and regionally. So you find that a lot needs to be done, and that is why I refer to it as a silent cry for action. So stillbirth is a silent cry for action. These babies are crying for action to help reduce these deaths. Now, somebody may want to know, what is the definition for stillbirth? A stillbirth is any baby that is born after 28 weeks pregnancy, not showing any sign of life. So a woman becomes pregnant for 28 weeks, she delivers, and this baby does not show any sign of life. I'm using 28 weeks as WHO prescribed, but other places they can use 22 weeks, or some people even go down lower to about 20 weeks. But for our purposes, we are using 28 weeks of pregnancy. And this child comes out of the mother's womb and doesn't show any sign of life. And by any sign of life, I'm referring to the child not breathing, the heart not beating, and there's no movement. So this child comes out of the mother's womb. You can listen to the heart, you will not hear anything. You look at whether the child is breathing, the child is not breathing. You lift the arm just falls down. So there is no sign of life in this baby. And it is very pathetic, isn't it? So that is a stillborn. And it can happen in a child that has been in the mother's womb for 9 good months. So it can happen in full-term babies, but we use the cutoff of 28 upwards. So any child 28 weeks upwards who is born dead is referred to as a stillbirth. This is different from a miscarriage. Miscarriage, the pregnancy is lower than the 28 weeks that we are talking about. The reason is that at 28 weeks, if this child comes out of the mother's womb, the chances of this child surviving, if it was born alive, are higher than if this child is born before the 28 weeks. So we have the miscarriage, which is different. In another session, we will talk about miscarriage, but today we are talking about the stillbirth. Well, ladies and gentlemen, if you have just joined us, this is the online pregnancy school, and today we are talking about a neglected topic or an area that is stillbirth. It is an issue that needs to be addressed because of the pain that it can cause to families. And this is the place where I want to invite you. If you have not yet subscribed, please go ahead and hit that subscribe button, turn on the notification bell so that when we have a program coming up, you will be duly informed. And I also want to encourage you to go back to our previous sessions and listen to them. Some people have listened and they have benefited a lot from them. As I said, today we'll be looking at part of stillbirth, and then we'll continue in our future sessions. But today we are looking at some of the aspects of stillbirth. So we have learned about the definition, and then we have learned about the pain that it can cause. Now, why should we be concerned about stillbirth? Is it an issue that we should be concerned about? Yes, we should be concerned about, because of the huge numbers. Because of the huge numbers. So globally, around the world, every year, we have about 2.6 million babies born dead every year around the world. That is a huge number. And that translates to one baby born dead every 16 seconds. So since we started, you can imagine the number of babies that have come out dead. That is not good enough. And the unfortunate thing is that out of this huge number, 2.6 million babies born dead around the world every year, over 96% of them, about 98, occur in low and middle income countries. So huge numbers of families are going through pain because their babies were born dead. That cannot be allowed to continue, and that is why we have brought to you a whole lot of topics about pregnancy, so that you know what to do when you find that there's something going wrong. Now, because we are in Ghana, let me just say a little bit about what happens in Ghana. In Ghana, there has been a lot of improvement, and there are a lot of interventions that have been put in place to help pregnant women to go through pregnancy and have successful outcomes. But we still have some of the babies who come out dead. And if you look at the statistics, if you take 1,000 women who deliver, we find that between 12 to 16 of them, the babies unfortunately do not survive. So we have that number that is born dead. Not very good, right? Well, that is why we are doing this, so that we see whether there's anything we can do to reduce that. Now, globally, the world has come together and realized that something has to be done. We cannot just allow these 2.6 million babies to continue dying. So the World Health Organization, with the countries that are together, are saying that by 2030, which is less than 10 years from now, every country must try to reduce the number of stillbirths to about 12 or lower per 1,000 births. So you find that every country has a role to play in reducing the 2.6 million deaths that are recorded around the world every year. So if one country does well and another country also does well, the numbers will come down and families will now be happier. So if you look at it, you may say that, 12 per 1,000 is not much. But if you count them as human beings, every 1,000 we have 12. Every 1,000 we have 15, 16, 20, any number. That is a huge number. And that is why we are calling on everybody to help to prevent these preventable maternal and newborn deaths. Ladies and gentlemen, having known about the statistics, having known about the definition, let's look at the types. So now we have two main types of stillbirths. Two. We have the one that occurs way before the mother delivers, which is referred to as the antepartum or the macerated. And this is a child who is born dead without any sign of life, as I spoke about, and also shows some signs on the skin, that the skin is peeling off. So this handsome or beautiful little child is born, but the skin is peeling off, which means that this child has actually died sometime before the mother delivered. And Sometimes they even die and stay in there for long hours, days before the mother delivers, because of probably where the mother was, and it has its own effect, which we will look at in the future. Now, the other one is what we call the intrapartum, or the fresh stillbirth. So the first one is the macerated, and this is the fresh, showing that this baby died not too long before the mother delivered. And the baby does not show any sign of life. The heart is not beating, the lung is not moving up and down, there's no breathing. The child is lying down without any movement, but the skin looks so nice, as if this baby is just asleep. And that is the intrapartum, or the fresh stillbirth, and that is the name, the fresh stillbirth. Now, around the world, it's been seen that if you take 100 babies that are born dead, you find about 40 of them, so 40% of stillbirths occur during this time, when the mother went into labor. When she had the pain, the baby was alive. When she started labor, the baby was alive. But by the end of the labor, by the time she finishes with delivery, unfortunately, this baby is gone. So the baby comes out looking very beautiful, very handsome, as if the child is sleeping. But unfortunately, the baby is dead. So that is the intrapartum happening during labor, before this baby comes out. Not pleasant, right? So what are some of the causes of these stillbirths? And I will look at them under various sessions. One of them is that the cause sometimes is not known. They don't know why these babies died before they were born. But there are also some things we call risk factors, and there are also some things that they call the causes. But what are some of the things that lead to these babies being born dead? And this is where, if we know them, we can do something about them, and we can help to reduce these preventable deaths. So if you take the mother, some of them are to do with infections in the mother. If this mother has like malaria, or she has other infections like syphilis or HIV, or other infections that travel to the baby whilst the mother is pregnant, then some of these can lead to the baby being born dead, or a stillborn baby, a stillborn. So you find that the mother plays a role in whether the baby will come out alive or not, for those that the cause is an infection. And that is why if you take your antenatal serious, you find that there's something going wrong, you find that you are not feeling well, do not on your own go and buy any medication and take. It's advised that you go to the hospital so they can do a proper check on you and give you the appropriate treatment. If you take syphilis, syphilis is treatable. We can treat syphilis. Malaria can be treated. HIV, there are ways of managing the women. So there's no reason why you should have any of these and stay at home. That's why I always say that use the hospital. Go to the hospital. It is better. Then there are also the issues about medical conditions. You know, sometimes a woman may have a pre-existing condition, which means that before she became pregnant, she had a medical problem. Maybe she had hypertension or diabetes or kidney problem or something else. But there are also those that occur when she's pregnant. And one of them is hypertension. The other one is diabetes. We have spoken about hypertension and what it can do. It can cause what we call the preeclampsia and eclampsia. Hypertension in pregnancy is a very serious complication. It can be very serious. So we ask that do not take the hospital lightly. If you go and you are told that your blood pressure is going up and therefore we have to see you more often, please go to the hospital. If you are even told that come tomorrow, go, because it is one of the major causes. Hypertension in pregnancy is one of the major causes of maternal death and also a major cause for stillbirth. And it can leave this woman with a lot of complications even after she has delivered, or if unfortunately she loses the baby, including death. So that is a very serious thing. And then diabetes is also another one where if you go to the hospital, they check your sugar, they check your urine, they check you, and they say that you have developed diabetes. Even though you may not have had it before you became pregnant, it can still be managed. You can be treated at the hospital. So please, don't stay at home. Do not stay at home. Whatever you are asked to do because of a diagnosis that is made, go ahead and follow the instruction. There are also the other women who unfortunately smoke and they drink alcohol. We have done a session on alcohol use in pregnancy. It can lead to stillbirth. And if the child doesn't die, you know what will happen. We mentioned a whole lot of things that can happen to this child if the mother drinks alcohol. That's why we said that alcohol in pregnancy is not acceptable. It should not be done. Do not drink alcohol when you are pregnant. So these are some of the things that can happen from the mother's side. Now, in some cases, they talk about the age of the mother. If you are too young or too grown, then the chances of you having this, because of the effect on the baby whilst the baby is inside not growing so well, that can also lead to stillbirth. But it doesn't mean that because I'm this age, I'm going to have stillbirth. No, it doesn't mean that. And that is why when you go to the hospital, everything is put together to assess how the baby is growing and how you are also doing. So don't think that because I'm maybe 35 or past 35, I'm going to have a stillbirth. No, that is not the case. There are different other things that come together to cause the stillbirth. Now, another thing we're going to look at is in this child, whilst the child is inside the womb. Why is it that some babies come out dead? There are issues to do with the growth of the baby whilst the baby is still in the mother's womb. If that is restricted, if this child doesn't grow well as the child should, then the chances are higher that this child will come out dead compared to a child that grows well. So we refer to that as growth restriction. The growth is restricted. The child is not allowed to grow very well because of one or two reasons. That does not happen. The child doesn't grow well. And it is to do with the function of the placenta. The placenta is the thing that feeds the baby. So if there's a problem with the placenta, for which reason food going to this baby is not going well, the baby is not receiving oxygen, the baby is not receiving the nutrients that this child needs, then the child will not grow well. And there are things that can happen to the placenta to make the placenta even smaller than it should be, and that will affect how the baby is fed and how the baby is growing inside the mother's womb. And so this can also lead to stillbirth being born. And then if a child, unfortunately, is too small for the age, then the chances of this child also coming out dead are higher than a child who is the size that he or she should be for that particular age. So if the child is 6 months or 7 months, but is looking like a child who is 5 months, then this child's chances of not coming out alive are higher. There are also what we call the abnormalities, where some of them can be seen with the naked eye, others we cannot see. They are to do with the chromosome, the thing that makes the human being. So those ones, if they also occur, then you find that this baby will be born, unfortunately, dead. There are some that are physical. You can see with your eyes that this child's head is too small, or the child's heart did not form well, or the child's kidney or liver or something happened whilst the child was developing inside the mother's womb. And when that happens, then this child can't be born dead. And so that is why pregnant women are advised not to be taking any medication that has not been prescribed for them, especially during the first 3 months of pregnancy, the first few weeks of pregnancy, before this child becomes well formed. If you take anything that disturbs the growth and development of this child as it's developing inside the mother's womb, then you can harm this child, because the child can have abnormalities that will not be compatible with life. So this child can be born dead. I hope it's clear. Yes. So now the other things that can lead to a child being born dead are to do with the health system. We have looked at the mother, some of the things that can happen to the mother which can lead to the death of this baby. We have looked at the child, and now we are looking at the health system. So with the health system, access, how soon, how quickly, how widespread, how close the system is to the mother is important. So if a mother needs care and the hospital is maybe so many miles away from where she is, then getting there becomes a problem. And that is why I know that in a lot of places, there are smaller facilities that have been built within communities that these mothers can go to. And that is why it's also very important that they go for the antenatal and go for the pregnancy school. So when you go for the antenatal, they check everything. So you know if there's something wrong. And if there's anything wrong and you are referred, then you go early. Even if the place that you are referred to is far from you, at least you have the time to plan and go there. So the access to healthcare is important. It could also be financial access. I said from the beginning that if you have health insurance, a lot of the things are for free. But in some instances, you may be asked or you may be required to also pay some money to do something. If that happens and you don't have any money, then the chances are that you will not do that. You will stay at home, and then whatever will happen, will happen. So please, once you become pregnant, start saving some money, a little at a time, so that when you need money, you have something that you can fall on. I hope it's okay. And the men, we have spoken about the role of the man. That is one of the things you can do. Start putting down some money. Even if you have just got married, start saving for that pregnancy. Start preparing for the pregnancy so that you can have that financial access. And if you're a pregnant woman, you are not registered with the health insurance, it is important that you do that, because financial access is also key. Now, for some of them, the access is because she did not like the way she was treated when she went to deliver her child, the first one or second one, or that a friend said, these people, if you go there, the way they will speak to you, the way they will treat you is not good, so I'm not going. So that one also prevents some women from going early. And that is not the best, because by the time you get there, you don't know what would have happened. And then for some of them, it's also because of the belief that do not go early. Stay at home. Wait till the labor is well established so that when you go, you will not stay too long, then you deliver. That is also denying access to this woman, because remember that about 40 out of 100 of these stillbirths occur when the woman is in labor. So if you delay at home, you may be contributing to the 40%. And can you imagine having been pregnant for 9 good months and losing your baby because of poor access? That is not good enough. So that is something. And then sometimes there's a facility or a hospital or health center close by, but what is needed may not be available. If you have a health center that cannot perform cesarean section, and this woman goes there and she needs cesarean section, then she has to be referred to another place where they can do that. And that can also lead to delay in receiving care, and that can unfortunately lead to the death of this baby. So that is also one thing. And then the weak referral system. Sometimes we have referrals that are not very sharp. So if she's at a place and there's no transport or whatever she would need to move from one place to the other, or they cannot call the next place, or they call and they say this place is full, then of course that referral will be delayed, and therefore access to the needed care will also be delayed. So she will not have the needed care, and unfortunately that can lead to the baby's death. The other things that can lead to a baby dying are to do with the state of this mother and the family. If they are not well educated, sometimes they don't educate themselves, not about formal education, going to school and all that, but if they are well informed, it helps to recognize some of the conditions and take action. If they are not well informed, then they wouldn't even know that this is happening. We spoke to some women who had stillbirth, and some of them said when they did not feel the baby moving well, they didn't even know what was happening. But in other places, if somebody knows that if I don't feel the baby moving, I need to go to the hospital, that is a way of reducing these preventable deaths. So sometimes it is not about going to school like formal education, but being informed about pregnancy. And that is why we bring you the online pregnancy school, so that you know what to expect. And if you expect anything and you don't see that, then quickly you know that there might be something wrong and I should quickly seek attention. So that is one of the things. Now, another thing is to do with the nutrition of the mother. The baby feeds from what the mother eats. So if this woman is not well nourished, then something else can happen. Now, when we are talking about nutrition for the pregnant woman, we are not talking about things that are out of her reach. No, we are talking about things that are within her reach. So if it is the green leaf that you have available, which is within your local area, eat that one. If it is the cassava, if it is the yam, whatever is within your local area, that is what we are talking about. We are not talking about you going to look for something that you cannot buy. No, because these green leafy vegetables are very good. So if you go to the antenatal and you are not even sure about a particular food item, you can ask the midwives. And that's why it's good to attend the pregnancy school. It's an informal place. They talk about everything and anything. And you can also ask questions. So please do that. Okay. Yes. So nutrition is very important. In our previous session, we spoke about nutrition, what the pregnant woman can eat to stay healthy so that the baby would also stay healthy. It would be very unfortunate if out of not eating well, you lose your child. That would not be good. Now, another thing that can lead to the baby being born as a stillbirth is to do with household pollution. Some people use firewood and the smoke is all inside. You see a pregnant woman inside there. It's been found. Research has been done on a lot of these things, and they find that some instances of stillbirth, they could trace them to the mother inhaling the fumes from this, and there are some things within the smoke that affected the baby, and therefore this baby was born unfortunately dead. So that is also something which we need to be aware of. Ladies and gentlemen, today we looked at stillbirth. I've told you that it's kind of a neglected area globally and even nationally. In many countries, they don't talk about stillbirth. In the homes, they don't talk about it because some of them believe that this child was not meant to live. If the child was meant to live, the child would have survived. So this child came to visit us and the child is gone. But we have looked at some of the causes, and they are to do with the mother, the baby, the health facility or the health system, and then the general community. And some of these things can be done to prevent the deaths. Some things can be done to prevent the deaths. We don't want to continue recording over 2.6 million stillbirths every year. Today we'll end it here, but in the coming sessions, we will talk about how to prevent some of these deaths. And then we'll also look at what is being done globally, internationally, nationally, what is being done. Then we'll be looking at if there are any support systems for women and for families that have stillbirth. Because I've told you that for someone that I spoke with, 30 years since she had a stillbirth, it is still in her mind and it doesn't seem to go away. Anybody who has suffered a stillbirth will tell you that they haven't forgotten about that baby. even if they've had 4, 6, 2, 1 children after that, they don't forget, because that child was loved. The mother was hoping to see the child, the father was hoping to see the child, the siblings were hoping to see that child, and unfortunately this child did not survive. There are things that can be done to help these babies to survive. So don't forget to hit that subscribe button, turn on the notification bell, so that anytime we are coming up with more topics, you'll be informed. And please invite people. Invite somebody to join the online pregnancy school, because we are on this journey. We are helping to reduce preventable maternal and newborn deaths. Well, I hope you will join me in my next video. Once again, my name is Dr. Linda Vanotoo, and I am always happy bringing you the online pregnancy school. Have a good day. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanotoo on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.